I was nervous the first time that I went for dental implants, but going back for round two, that unlocked a whole new level of fear.
What makes someone say yes to getting dental implant surgery again? Well, Sharal is here to share exactly what pushed her to do just that.
And in the second half of this episode, I will show you my new smile and tell you if it was really worth it.
It's so good to see you, Sharala. But before we dive into your decision to get a second dental implant surgery, tell me when you had your first surgery done and what you had done. You're going back a second time, so did it not get the job done the first time? Tell me what was going on with that.
Oh my God, that's a loaded question, Marissa. So, first and foremost, I first went to Nuvia in June 2022. And I had my top arch done. So at the time, I had all of my top teeth removed and I had 4 implants placed. And then I received a Nuvia arch 24 hours later. And so the top arch is what I had done. And so did it not get the job done? It absolutely got the job done because at that time, I was really focused on my top arch, which was the priority. I needed that to be able to eat well, to be able to have a nice smile. And so it definitely got the job done for what I needed in that moment.
What has life been like since getting that top arch? And how has your life changed since getting it done?
Oh my gosh, life has totally changed. It has been, I don't really have a lot of words except for I just kind of put it in different categories, right? So my personal life has increased all of my social interactions in regards to just being okay with smiling at others. Also at work, my confidence increased because I do have to teach a lot and I'm in front of individuals a lot. And so just having the top arch done really did increase my confidence to the point to where I was okay with actually opening my mouth again, and not being afraid to step into a boardroom and actually speak my truths, speak whatever it is that I had to add to the conversation. But most importantly, my health, my overall health improved because I was having a hard time eating. A lot of my teeth on the top were loose and they were gapped and they were turning. And so I couldn't eat properly. I hadn't been able to bite into a sandwich in years. And so it was just so unstable inside of my mouth that with the Nuvia arch, I've been able to eat better and I've been able just to really have better overall health.
How did it make you feel to only have the top arch done? And did people ever comment and ask you, oh, you got dental implants? Well, wait, what happened on the bottom, right? Because I do see you are missing one tooth on the bottom.
Yeah.
Did people ever make comments asking you why you didn't do the bottoms as well? Did you feel incomplete?
Yeah, absolutely. I mean that has happened to me more times than not, actually. And I will tell you, every time that someone did ask me that, it's kind of like, okay, I know what's going on, and I've always thought in the back of my mind that others, they can still see, even though I know that this smile has drastically improved from my before, I know that it's still imperfect with my natural bottoms. And so always in the back of my mind was, others are seeing it and are they going to say something? And many
Mm.
times people did. People would ask me in person, like, hey, I know you got dental implants, but what happened down there? And maybe thinking that like the dental implant arch broke or something.
Oh.
And it's kind of like, no, these are my natural bottoms. And then it's always the conversation of how do I explain why my bottom arch is imperfect. And so I really had to, even though, like I said, my confidence increased, but I also had to kind of like bolster my self-confidence and saying like,
Mhm.
I am not my imperfections. I am me. Right. And I have to just accept who I am. And whenever somebody does approach me about it, I just have to own it. I have to own my imperfections. But of course, it left some insecurities because aesthetically, it is a distraction for individuals.
I think it's cute and it's a
Aw.
darn cute distraction, but I can understand what you're saying. And I think inquiring minds want to know, is there a reason you didn't get them both done together at first? And why a second surgery day? Some people might think that's crazy.
Right, right. Well, I will tell you, at the very first time, my very first visit, my bottom arch, it had mostly healthy teeth. And so Nuvia is not about the practice of just pulling healthy teeth just to pull them. And so they actually gave me other options. They were like, you really could save your bottom arch and just go to a dentist and see what are some options. There at Nuvia, they do not do single implants. So going with Nuvia was not an option for me. So they did actually refer me to someone. And I went to that dental office, and, they had given me some options, temporary options, many different types of temporary options, to also include a singular implant as well. But because even though I'm missing one tooth, my gap is wider than one tooth, right? And
Mm.
so I was so concerned about what that single implant look like in there, because
Hmm.
the dentist kept telling me, well, I can make it like two teeth, but I know it's only supposed to be one tooth in there. So I could never wrap my head around, what is this going to look like, And then I also just did not, I couldn't accept the thought that I was going to have something in and take something out. And am I going to be able to eat with it? Am I going to lose it? Am I going to throw it away? Like, just the maintenance, all of those things. And so I just said, at this time, it's just not even, I'm good. They were functional. They were healthy. I could eat, but everything else that's left allowed me to increase the functionality of everything in my mouth. It's just not aesthetically pleasing. However, now what has happened is, of course, without neighboring teeth next to them, we start to get shifts and we start to get spaces. And so I'm starting to see the shifting of the bottom. Although I may not have pain and I may not have like infections like I did before, I am definitely seeing the integrity of the bone is starting to wane, because of the missing teeth that were there. For me, their integrity in that, the fact that they came to me and didn't try to sell me on something that I didn't need, that made me have so much trust in them, because I knew that they really had my best interest at heart. So definitely, that's a plus in my book for Nubia.
I bet. Well, when are you scheduled for your next surgery?
In 2 weeks, on the 21st of May.
2 weeks from today. Okay.
Yeah.
How are you feeling? Are you nervous? Some of the same nerves as before, or are things feeling a little different this time, seeing as you've gone through this once?
Actually, I'm feeling a little bit different. I mean, I think a lot of nerves come with the feeling of the unknown, because you don't know what to expect. This time around, I feel like I kind of know what to expect. Having the support of the Smile Maker Club and being a part of that, and just really knowing the Nubia family has been really helpful, because I know that I have a team of professionals behind me every step of the way. But of course, anytime that you go under anesthesia or you have a major surgery, because that's exactly what this is, there is a little bit of fear, There's that
Mhm.
little bit of, hopefully everything's going to go okay. And then also, like, once they get in there, we want to make sure that everything it may look great inside of the scans, but once they get in there, does it feel right, And so I do have, just those little things. But other than that, I'm not too concerned about like the recovery or downtime. I'm actually pretty optimistic about that.
Shirala, why did you decide to get it done at the same company? Why are you so confident with them?
I am confident with them because I know that they are going to take care of me. And also, I know that I'm going to have a permanent smile in 24 hours. Other places may take a long time where you may not get a permanent smile. You may have something temporary. You may have to let the implants, stay in and then maybe 10 months later get something. Why go somewhere else? Like don't fix something that's not broken. That's basically what it is. It's like, I know the integrity of the company. I know that the professionals that are there have my best interest at heart. I know that they know what they're doing, right? And they're like family to me, actually. I mean, I feel like when I walk in, I know everybody. And it's just very comforting to know instead of having to go somewhere else where you don't necessarily know the individuals, you don't necessarily know like what is their experience level with doing dental implants, and are they
Mhm.
going to have a team of professionals, or is it just going to be one person that's taking care of everything, right? So instead of having to relearn something and take a chance with something that I don't know, it's best for me to go somewhere where I know it's already tried and true. I've gone through it before and I know the great experience that I had before. So also, I'll be able to eat right away. I don't have to do liquid only. I can go onto a soft food diet, anything that can be cut with a plastic fork. So, I mean, why not? So that, and then also the fact that the first time I did not experience any pain to talk of. It was just, I had some discomfort, some pressure, but no pain to really talk of. And I get it. I know it is a major surgery, right? And I often wonder, I even asked the prosthodontist about the bottom arch, like what's different? Like, should I anticipate something different, right? Because I had such a great experience with the top arch of minimal pain that I don't want to jinx myself. I'm just hopeful that the bottom arch will do me well too. So, yes.
Fingers crossed, because as you mentioned, it is a big surgery. And it's so great to hear that you really didn't have any pain with your first surgery. And again, everybody's different and
They
everyone's going to
are.
have a different experience.
Right, right.
The fun part of this episode together, this podcast episode or video podcast, if you're watching our video, is that we're going to actually let you go here in a few minutes. And we're going to let you go and have that second surgery. And then we're going to come back and talk to you just a couple weeks after that surgery and hear how it really went, what it felt like. We'll talk pain again and you can weigh in and let us know. Is that still the reality that you really had minimal pain? I mean, I'm excited to be able to talk to you after your second surgery. But one thing I want to ask you about too, I've heard that the success rate for Nuvia's dental implants is actually higher than the national average. Do you know if that's true?
Well, I have heard the same. I think it's like 99.1% or something like that, like almost 100% success rate. And that
Wow.
is really astonishing to hear that. But it's very comforting to hear that as well.
Shirala, what are you most excited about with getting this second arch?
Oh my gosh. You know what? I just don't even know how far my confidence can go. And I am really just trying to figure this out. I've been like practicing my full smile, right? Because I've got down the one arch smile. I got that down pat, right? Like, ah! But it's like, how do I get
How do
all
I
the
show
teeth
all
in?
my
Right?
teeth, right?
How do I get
Yes.
it in? So I'm super excited about having a full mouth smile and also just I just anticipating like, where does it go from here? Like, where does the confidence go from here? Because sometimes you don't even realize what you're missing out on or what you're hesitant about until you actually get there. Right. And it's like, this is what I've been missing out on. Ah, so that is one thing I'm just super excited to see unfold.
Well, I am so excited for you, as I'm sure our listeners are as well. And I think this is a great time to just pause our conversation.
Okay,
We'll pick things back up after your surgery. How does that sound?
that sounds amazing.
Awesome. Well, wishing you a wonderful surgery, and we will all just be hoping for the best outcome for you.
All right. Well, thank you. See you soon. Bye-bye.
Now, before we jump ahead to see how Sharala's doing after surgery, if you want to know what dental implants from Nuvia could cost you, just click the link in the description below to get the free dental implant cost guide. Okay, Sharala, you are back after having your second dental implant surgery. Excited to talk through what this has been like for you. But first, I need to see this smile up close, girl. Come on in. Let me see. Gorgeous. I mean, you were beautiful before, no doubt. But now, I mean, hello, hello, hello. You look amazing.
Well, thank you. Thank you very much.
Share with us, how long ago was your surgery?
It was just over 2 weeks ago, about 2 weeks and a couple days now.
Now, what was surgery day like? Can you compare the very first time you went in for dental implant surgery to this second time around? Was there anything different, or for the most part, did surgery day kind of look the same as last time?
Yeah, I will tell you the only difference that I could tell was with me, right? I think I was a little bit more attentive to what was happening, like trying to be very intentional about just capturing every moment and understanding everything that was happening. I think the first time around, my nerves, my anxiety, I was kind of like, I'm going in, I'm going under, right?
My anxiety, that anxiety song that's on Instagram, the
Right?
anxiety. I don't even know how it
Yes,
goes. But
that
yes,
was
like
me,
creeping up.
right?
Yeah.
And this time, I didn't necessarily have so much anxiety. I did wake up that morning, though. I did. All the butterflies woke me up that morning. And I was like, uh-oh, uh-oh. I have not been feeling this feeling quite as heavy. But I really did just calm myself. I was able to kind of read through other people's stories that morning. That actually helped me to see individuals that had just gone through like the day before, reading different posts on the
Oh.
Smile Maker Club. That really helped me to be like, oh my gosh, they just did it yesterday. All is going to be good, girl. And so everything, with surgery was really about the same. Everything was. It was just really myself being more attentive and intentional about just capturing every moment. But the procedure that Nubia did was pretty much the same as the first time. Not too much difference to speak of.
So, for the most part, other than your nerves and your intentions and your kind of like experience personally, and how you viewed things being a little different, for the most part, the surgery itself was the same. Did you have the same team of people? Not the same exact people, maybe, but the same team in the room with you, a CRNA, and then obviously the surgeon, the restorative doctor? Did you have that same team? Was the aftercare and how they treated you very similar to that first time as well?
Yes, absolutely. Everybody came in and they introduced themselves. I was able to meet everybody that was on the team. And yeah, it was a really, good experience, and they were very thorough. That's why I said the first time, I was just trying to get things done and like, but this time I really paid attention. Like, the CRNA came and was very thorough with just kind of all of the paperwork that we went over, and then once we got back, was very thorough about what is about to happen. I'm going to put this on
Mm.
and that on. And the surgeon came in, introduced himself. He actually was my surgeon the last time and said, I remember you.
That's ama Oh, that
it,
must have
it,
made you feel really good.
it
Familiar
did.
face like that? Yeah.
Yes, it did. And the dental assistant that was there as well, she has been with me the whole 3 years that I've been there. She's pretty much been the only person that has dealt with my teeth every time I go for all of my follow-up appointments. And so for her to be a part of the surgical team, we were both like,
Oh, this is
yeah.
making my heart feel warm and excited for what you went through, knowing that it was such a familiar experience, including familiar faces.
Yes, absolutely. And they were just so professional, and they everything that happened the first time happened the second time in regards to procedure. So I think at the end of the day, what I really liked about Nuvia and why I wanted to go back is because they have their process down pat. And it is something that you can find everywhere at all of their Nuvia centers. And so I had faith in them and trust that they were going to take care of me at the end of the day, just like they take care of all of their patients at all of their centers.
How are you feeling physically? How are you feeling so far, and how has the recovery been?
Yeah, I feel really good. The recovery went well. I will tell you, like, the ice is the answer. I did not necessarily swell too bad, but I did have a little minimal swelling. Pain, I did not. I will tell you on the first night, I was starting to feel a little bit of discomfort in like my bottom jaw. But I was like, you know what? It's been about 3 hours. Time for me to take one of my ibuprofen. And I stayed on top of that. I took my meds as prescribed. And I didn't feel after that, no more pain or discomfort to speak of. Um, and yeah, and no bruising. I never had any bruising. And I was always looking, like trying to figure out, no, no.
Was that experience also very similar, or was there anything that kind of stood out as being very different this second time around?
One thing I have noticed, there is a difference between the top and the bottom, right? And for the top, um, I remember the roof of my mouth being pretty sensitive, right? But there's not really that much sensitivity on the bottom. Like there's not sensitivity. But what there is that's different is a numb chin and bottom lip.
Oh, that makes sense.
Yeah.
Yeah.
So
Yeah.
that was a difference. That was such a difference, you know? I noticed that right off the bat, you know, but other than that, like, in regards to I didn't really have that much discomfort either for my tops only. I swelled minimally and I didn't have any bruising. So in regards to those, everything was good, right? But this time I will tell you, I think I was on like hyper mode of ice this time. The last time I was pretty steady with my ice as well. I would have, rotated and I would eat my cold treats and things like that as well the first time. But this time I like had ice packs on steroids. Even after I went back to work, I was still making sure to ice like before I went to work. And so I would wear the wraparound ice in the car.
I'm sorry, officer. I wasn't speeding. I was just icing.
Just icing the space, right? And so, but one day, I was weaning myself as well off of the ice too, because I was like, okay, the first day back, I went back like 6 days after. And on day 6, I was back at work. So I still wanted to ice. So I iced my face but I was off of meds. I didn't take any meds. So it was my first day with no ice all day and no meds all day. And so that was the big thing for me. I wanted to make sure I could still, ice at least until I got to work. And then I took the ice pack with me in my purse and I knew I could always put it in the freezer at work if I needed to in a pinch, right?
Like a little
But
lunchtime ice break if you need it. Yeah.
yeah, and I had
Smart.
my ibuprofen in my purse too, just in
Smart.
case. But
Yeah.
I did well. I didn't need either, but I will tell you I was running to the freezer when I got home because I just wanted a good cold ice, on my face, and that was
Yeah.
good. So I did that, and then the next day, did the same thing. But then the next day, I was like, okay, we are weaning ourselves off of ice. This is what we are doing. We are weaning ourselves off. So I took the ice roller with me. And I was like, I will just roll my face in the car and just kind of, do this. And so I did that. And then after that, I was good. So no more ice.
Well, I know the first time that you had dental implant surgery, you got your teeth 24 hours after surgery. Did you get your teeth 24 hours after surgery this time?
Yes, I did.
So, walk me through what that smile reveal was like compared to the very first time, and what you felt emotionally. What was going on when you went back the day after surgery? Walk me through that afternoon.
Man, okay, so that day was a day. That was a wild ride of a day. Not what I was expecting at all. I was expecting to go. I knew that I had a special visitor in town besides my family. So my family was going to be there for my reveal, and I also had a special visitor that came. And so she was there as well. And so, I go in, and of course I'm like super excited because I'm gonna finally see myself with two arches. And I could never visualize. I really tried in my mind to visualize, like, what will I look like with two arches? It never came to me. I had no idea what I would look like. So I was super, like, excited to and anticipating this, the delivery of, my arch. And so I remember going back and sitting down, and my family was there, and they did the whole reveal and gave me the mirror, and I turned around, and y'all, I couldn't stop looking at myself.
Why am I not surprised, Sharala? I
I
mean,
I
it's
wouldn't give
you, but this is a big deal.
it
Big
was.
deal.
I would not give the mirror back. I just kept looking at it like, oh my God, like, oh my goodness. Like, I could not believe it because I didn't know what to expect. So I'm literally, I don't know if I was in shock or anything, but I just was so happy. I was so excited,
Mm,
and they felt so good because that was the other thing I thought, like, now that I will have like a full mouth of teeth, will my tongue feel crowded, right? Will I
mhm.
be able to speak? I was thinking like all these different things. I was just so happy how how they feel. They feel really comfortable.
Yeah.
They're very comfortable. My tongue didn't feel out of place or anything. So I was just happy with the feel of them. So then to actually see the look of them, I was blown away. I just kept looking at myself, and I was just like, oh my God, they look so good.
Oh, I can still feel the excitement. I feel like I'm in the room with you. And I know I actually tuned in and was watching this live stream that you were doing from the Nuvia Center. But I can still feel that excitement and that energy from you here, even just 2 weeks after. So,
Yeah, it was a super ride. And so that is really what you just talked about. That's the whole going live, and then the surprises that came with it. That was definitely different than the first time, because I had two of my Smile Maker Club friends actually come into town to surprise me and be there for my reveal. And there is no words. I really have no words for that. Like, they surprised me so much in the live video. You can tell I saw them. It was like I was looking in a rearview mirror because I never turned around. I just saw in the video who was coming through the door. I lost it then. That's when I lost it. Like, that's when I was truly just overjoyed. I was amazed. Oh, I just don't, like I said, I don't have the words because for somebody, and not just one person, two people, three people really, um took time out of their lives to fly from their home to come to where I am, to be there for my reveal of this, life-changing experience. I'm just forever grateful for that. It doesn't get better than that. And that is what being with Nuvia is about. It is truly family. That it's family. Like, that's not something that you can just make up. Those are real relationships. Those are real friendships. It's real family. Nuvia itself as a company is truly patient centered, and they care. The smile makers that work at Nuvia Center, they truly treat you like family from the first time you walk in the door. And so to know that you even have this extended family across the nation, you really do form a family bond with them because you have so much in common, and you have the opportunity to encourage and support and motivate when they're going through some of the most difficult times of their life. So it's not something that anybody could, say, well, this is what, what's going to happen. It's just something that happens organically. And I'm so happy to be a part of this community. It's changed my life.
Well, sitting here, I just have to tell you, this is a first. My cheeks hurt so bad from smiling so hard. Like, literally, my cheeks hurt, Sharala, because I have just been smiling since we got on this podcast together.
I
And it's
love it.
just, yeah, like my cheeks hurt because, like, I'm just so happy for you. I'm just so happy for
Oh,
you. And I'm happy for everybody who gets the chance
yeah. Yeah.
to like
Oh,
share this together, you know?
yeah. Absolutely.
You
Absolutely.
know, you know what I want to touch on for just a second too? It's there's a lot of people who don't have somebody on their team, on their side, in their family to talk to about their dental drama or their dental trauma like you shared, you know?
Mhm.
Some people are so embarrassed and I know one of the friends that came to see you, I talked to him once. His name is
Mhm.
Randy.
Yeah.
He said he was almost a recluse for so many years because of his dental problems and the embarrassment, you know? So to be able to come into such a warm and welcoming community of other people who can say, I've been there. Sharala, I know what you're going through. I've been there.
Yeah.
And also to say, I know what it feels like right now, Sharala, because I got my teeth too. And
Yes.
it's really wow. Like my mouth literally hurts from smiling, but it's just like the
It,
joy is so real and the happiness and like everything you're sharing so real but so beautiful.
it really is. It really is. Exactly what you're talking about with Randy. I even said that to him, in that day. And I said to him, I said, "Oh my gosh, like there was a time when you didn't leave your house and now you got on a plane and came all the way to San Antonio to support me. Do you know how good that makes me feel? Like to know that how much it took just to go out the house. And now you've got so much confidence back that you were like, yes, I want to go and support her. And how could I not feel the love or feel the joy from people that are
Mm.
genuine about the journey and really trying to support and encourage and pour their love onto others. So
Okay, girl, you got me crying now too.
I'm
What is this?
sorry.
Oh, honey, I'm so happy for you. And, you know, for all the people who have come together and been
Yeah,
united through their
yeah.
journeys of having dental implant surgery because it isn't just a surgery, right? It's
No.
a new chapter in someone's life. And
Yeah,
I think people might underestimate what that new chapter can look like. I mean,
you're so
you're
right.
living proof.
Yeah,
Yeah.
yeah.
Okay. My mouth hurts from smiling. I'm already crying. Golly. Oh, man. This is so fun. It is so fun to hear your story. And I know your surgery was just literally 2 weeks and a couple days ago.
Yeah.
And you've shared, you know, what recovery has looked like for you. You've shared a little bit about the happiness and feeling good about having a full smile, but any other changes that you've experienced even in these last couple weeks?
I realize I really am just going for things. Like there is no hesitation. I have no reason, I have no excuse to stop myself from doing anything that I want to do. I think before I had like this tinge, of self-consciousness about my interrupted bottom, and I I would just hold back a little. I will tell you, life changed so much for me when I got my top arch. When I got my top arch, like things I gained a lot of confidence and I was able to at least not be so embarrassed because if you were to see my smile, my before Nuvia smile, you can tell what I mean because my teeth were going every which direction but straight, right? And
Mm,
so it was like that's the only thing that anybody I felt, and this is for me, my perception, I felt like that would be the only thing that anybody could focus on if I was to even open my mouth, right?
right.
So I just kept quiet. I remained quiet. I pressed the mute button, even though I had so much to share and so much to give and so many ideas that could enhance different things. I chose to be quiet because I did not want to be judged by my mouth. So when I was able to get my top arch, I felt like, oh my gosh, okay, this is great. Yeah, I may have a tooth missing on the bottom, but you know what? I can smile, I can give my half smile, and I can talk, and it's fine. I'm good. And I really I worked through all of that. But I still knew that I had times where I did not, especially like if I was meeting someone new, somebody that did not know me, or posting, publicly where people had an opportunity to see my bottoms for a longer
Mhm.
period of time than just a short moment, because I was hesitant, like, are they going to comment something, And I have thick skin, and I really did. It really is about accepting yourself for who you are, and that's where your confidence comes, not trying to seek confidence or acceptance from the outside, like external things, like really building yourself up from within. So I've been able to do that. But I will say there is that small voice behind me before my second arch, like kind of just holding me back because it's like, they're going to say something, they may ask a question. But now I have nothing holding me back. So I was just saying that now I'm being so intentional because I realized that evidently whenever I see new people, like I'll just like, hi, like just kind of nod my head or, but now I am smiling at everybody. I'm like,
Hi, you're like Jim Carrey, right? Like, hey, girl, what's going on? You see this piece right here?
hello.
And rightfully so, Sharala. This is a big deal. You not only had dental surgery once, you went back again. You said, this is for me. I'm going to go for it. And it's so wonderful to hear that you feel like it was worth it. And that was actually going to be my next question. So, after everything, was it
Yeah.
worth going through surgery again? How do you feel with this complete smile? And what does the future look like for you? What are you most excited
Oh,
about?
oh my gosh. Okay. So absolutely worth it. Absolutely going back again, like hands down. There's no question, concern, ever, no hesitation, no regrets at all. Like, hello, girlfriend. New you is here, right?
Let's
So
go.
so
Okay.
excited about that. And what I'm excited for in the future, you know what? I've been doing vision boards for a very long time. And this smile has been on my vision board for a very long time. I think now I can focus on something else that, has been in my heart to do. And I've been hesitant to do it because I guess I was afraid of public opinion. And now I'm not. Um, I think that I've got all the goods that I need to be able to move forward. So I am super excited about where, my next dreams, lie. And now it's time for me to start goal planning for that. So I'm super excited for it.
I love that. So it's almost like one arch chapter is closed, opening up chapter two with the double arches.
Yes.
And chapter three might be just a whole new journey that's been inspired by
Yeah,
chapter two.
absolutely. Absolutely. Can only go up from here. So the sky's the limit.
Heck yes. Well, Sharalo, what would you tell somebody who is thinking about dental implants, but maybe feels hesitant
Mm.
or even thinks it's out of reach? What would you tell them?
Well, I would tell them that don't wait. Okay. Do not wait. I know myself, I had fear about bone loss because I thought that I had waited too long. Um, and good thing I did not. And so in the moment right now, it's better than 1 year from now, 2 years from now, 3 years from now. So just don't wait, look into it. Um, Go seek out a consultation. There is nothing that you're going to lose by going. It's a free consultation. You will at least have an idea of what is available for you, right? Is Nuvia
Mhm.
right for you, or is something else going to be right for you for your optimal dental health? That is the best thing that you can do, is go and get answers. And then also, if anybody's ever wondering about like financial concerns or financial options, there are financing options available through Nuvia. The Nuvia team can help you with that process. But if you want more information about the cost, there is a cost guide that you can download, and you can find the link in the description.